So far, we will look over why it's difficult for the assembly fix to be performed correctly. So, it becomes the criteria of choosing the one-piece fixture because it's it to be performed properly. Usually, I consider these 5 criteria together and decide which is better to be planted. However, proper procedure is my top priority. It's because no matter how well we can choose the fixture to be planted, it's useless if the process goes wrong. In addition, the problems coupling structure take place in most cases, especially when the diameter is small. It happens quickly. In other words, if the bone width is narrow, one-piece fixture is usually advantageous despite low success rate of integration. Now, let's look over why one-piece fixture is to be performed properly. There is no coupling structure, and also the straight couple is available in the one-piece fixture because it's an all-in-one type. So, we don't need to care about the depth of the implantation, and so it's okay if we plant it deeply without gingival flap. In addition, after we intentionally punch out the gingiva as small as possible, the gingival healing and implantation can be performed at the same time without the gingival flap. So, the procedure is very simple and the gingival healing is good. And there is no process of coupling the abutment in the first place. So, the whole process of one-piece fixture is simple and easy to perform as long as it's planted properly. On the contrary, most of the weak points of assembly fixture stem from the fact the hexa abutment is likely to be coupled incompletely. So the alternative is the round abutment, although it's undesirable. However, if I didn't use the one-piece fixture, I had no choice but to use the round abutment when the assembly fixture is planted deep. But I'm going this way because it's right in theory. So it's my way. However, the results of round abutments are not always undesirable to me either. If the diameter assembly fixture is right, the roundabout is not bad because the problem happens slowly. However, just like I said, if the diameter is small, the problem is happening quickly, even though the roundabout is coupled. So, one piece is better. Therefore, the one-piece fixture has the best results in a case with narrow bone width and good bone quality. In particular, if the diameter available fixture is only 3.0 mm at the frontis side and only 3.5 mm at the femoral side, the one-piece fixture is better than the assembly fixture, definitely. And one more thing I want to say is, it's misinformation that the one-piece fixture breaks more easily than the assembly fixture. After experiencing a lot of cases of one-piece fixture over the 9 years, I've been convinced that the one-piece fixture usually falls out because it shakes rather than breaks. However, assembly fixture with small diameter usually falls out because it breaks in the early time. Anyway, even though it seems obvious that planting the one-piece fixture has advantages in some cases, Why it's not popular among the dentists from the past to the present? Probably there is a combination of many reasons. Among them, I guess it's because the dental implant has short history. So, we dentists, including myself, need to learn more about implants, and we are still learning. Therefore, for the moment, we had no choice but plan the assembly fixture because the failure rate of integrating of it is low. And we couldn't afford to pay attention to one-piece fixture because the success rate of integration of it is low. So anyone didn't know much about the one-piece fixture and could not guide us to it. So I had planted the assembly fixture for more than 15 years, and I realized the limitation of the assembly fixture by myself, and I invented and planted one-piece fixture on my own, and it's been almost 10 years. So as beginners about the implant, they don't know, they don't even have a need for the one-piece fixture, and most of all, they are scared of planting it. And cannot plant it properly because there are separate protocols for the implantation and making treatment plan, the fixed design suitable for the one-piece fixture. But they cannot understand that because they are the beginners. So after experience intelligence failure, the inexperienced many give up early. Therefore, for the moment, I think only the experienced few can understand it, do it right. So it's kind of technology and competitive advantage now. But if even the inexperienced men are willing to do it and try hard, they can do it. Why not? Everything depends on their mindset and their efforts. However, I think the willingness comes after realizing the limitation of the assembly fixture with small diameter throughout numerous cases. Anyway, the one-piece fixture is for the experienced few now. Now let me show you 9-year-old case of one-piece fixtures. It's the panoramic view at the time of first visit. The upper partial denture wearing patient only want implant, only lower right side. The bone quality was good, but bone width was variable by region, however bad in general. I planted two fixtures of one-piece type to replace 44 molar and 46 molar for the bridge because I guess the amount of occult load that will be acting from the upper denture is small. After 3 months, the 3-inch bridge was set. However, after using for a while, she changed her mind to replacing the upper denture into implants. So I planted 7 fixtures of one-piece type from the 16 molar region to the 26 molar region. After 6 months, the long bridge was set. Now, let's take a look at CT scan view of low bridge that is 9 years old. Here's a view showing non-specific change after 9 years. It's a corner view of 46 fixtures, partially planted deep due to steep slope at the alveolar bone ridge. However, it was okay if it was one-piece fixture. It's corner view of 44 fixtures planted at the narrow bone ridge. Although the diameter of it was 3.5 millimeters, I managed to plant it into bone. It was more difficult to plant 12 fixtures replacing the lateral incisor. Even though the diameter of it was 3.0 millimeters, it was almost exposed out of the bones. There was no answer if it was not one-piece fixture type. Coronal view of 11 fixture replacing central incisor. Its diameter is 3.0 millimeters. It was better than 12 fixture, however, it's better not try to plant the thicker ones. Coronal views of 24 fixtures replaced the first premolar. Even though diameter was just 3.0 millimeters and the cup length was so long, it was planted partially deep, not fully deep, due to steep slope at the bone ridge. If it was assembly fixture, we had no choice. We have to use the round abutment with long and straight curve, undesirable coupling. So I think there's no answer except for the one-piece type with straight curve.